Turn up the volume. Get bearded. Let's start the show.
Welcome to Bearded Biomed.
Ladies and gentlemen, welcome back to an all-new episode of the Bearded Biomed. I appreciate you joining in, whether you may be tuning in through Spotify, Apple, YouTube, however you may be watching, however you may be listening. I appreciate you tuning in to me. Now, before I get into the episode, I just want to make you guys aware, if you haven't heard, I've partnered the show along with Amy in order to help you guys maintain your certifications. So if you're watching on YouTube, I would encourage you to instead go to beardedbiomed.com, go to Bearded CEU tab, and you're going to see an enrollment page. Once you enroll at canvas.com, you're going to have a full spiel of every episode that's available for either half or a full CEU credit that I personally can issue you guys a certificate with the official ACI stamp to maintain your CBET, CRES, CHTM. It's a simple way that I can help my colleagues, me giving back to help support you guys. I'm a proponent of certification. I want to help you guys keep yours. So be sure to check that out. Also, Ohm's Law Apparel. If you haven't heard, check it out. Every sale goes to fully fund scholarships, sponsorships, and community outreach, going speaking to schools, and just everything that I'm currently working on to uplift this profession. So appreciate everybody's support that endeavor so far. Only got to get greater and greater reach as we move forward. So I'm looking forward to seeing the impact down the line of what Ohm's Law Apparel can do. Be sure to like, subscribe, and share the show. And let's get into it. Now, before I get into policy, closures, or budgets, I want to talk about why this conversation matters to biomeds. Most of us don't get into the field to worry about legislation. We're problem solvers, fixers, keep it running people. But here's the truth. Healthcare policy doesn't just affect patients, it affects hospitals. And when hospitals are stressed, biomed departments will feel it too. Whether it's equipment budgets, staffing, or service contracts, these decisions are all shaped by larger financial and political forces. Everything like Medicaid reimbursement rates, federal funding for rural care. So no, we don't have to become policy experts. But having a minimal grasp of the U.S. healthcare landscape helps us understand why decisions get made and what pressures leadership is under. Because if we want to have a voice at the table, if we want to move into biomed management or lead departments, justify staffing and tools, we need to understand the system that we're working inside of. The further up you go in management, the more you're going to realize half the meetings are creative ways to say, we just can't afford that. That's what this episode is going to be about. It's not about sides. It's about survival for patients, for our facilities, and for the profession we believe in. More than 600 hospitals in the U.S. are currently at risk of closure. Over 200 of them are considered an immediate risk. Texas, we lead the nation. 26 closures since 2010. 12 more teetering on the edge of closure right now. Nearly half of all the rural hospitals are operating in red. And since 2010, 182 hospitals have either closed or downgraded to outpatient services only. And with new proposed legislation that includes $716 billion in Medicaid cuts over the next 10 years, the pressure on rural healthcare facilities is about to get a whole lot worse. It's not just a prediction. This is already a math problem that's failing. Medicaid is a joint program between federal government and each state. It covers healthcare costs for low-income individuals, children, pregnant women, seniors in nursing homes, and people with disabilities. In Texas, Medicaid only reimburses about 72% of inpatient care and 75% for outpatient services. Hospitals eat the rest of that cost. If the gap grows, fewer hospitals will be able to sustain operations. So let's pause and zoom out. A lot of people hear Medicaid cuts and assume it only affects individuals who are enrolled in the program. Let's put that in perspective. If a procedure costs a hospital $10,000 to perform, Medicaid might only pay them $7,300. The rest, they either absorb the loss or try to make it up through private insurance. If they serve a mostly low-income or elderly population, there's likely no makeup money coming in. It's just a loss after loss after loss. And here's the thing, even if this bill doesn't pass, things still aren't in good shape. Rural hospitals are already operating in the red. Medical reimbursements have been under cost for years. The safety net is already fraying, with or without new cuts. I want you to consider Madera Community Hospital in California that closed back in 2023. That left 160,000 residents without local emergency care. Over 770 employees lost their jobs, and patients had to drive more than 30 miles for treatment now. That's not a unique case, by the way. It's just a preview. So what happens when Medicaid funding gets cut even more? Hospitals don't close overnight. They just start trimming services. First to go, labor and delivery, psychiatric care, ICU beds, elective surgeries, eventually emergency departments. As of today, over 60% of rural hospitals in the U.S. no longer deliver babies. In some parts of Texas, pregnant women now have to drive over 90 minutes just to reach a delivery center. These aren't just medical losses, they're economic ones too. When rural hospitals shut down, a town can lose over $20 million in annual payroll. Any key infrastructure that supports EMS, pharmacies, and even local schools can go away. Now, let's talk about how all this lands on the Biomed shoulders. In rural hospital, Biomed's often a team of one. You're fixing new infusion pumps in the morning, responding to a vent alarm possibly at lunch, and assuming that hospital has IT, you're handling IT calls in the afternoon. The equipment is often older than it should be, which we're used to. I mean, we're talking 10, 20 years of device, and it's held together with borrowed parts and prayers usually. But when departments close, so do the machines. So OB unit, the fetal monitors disappear. ER, the crash carts go to storage. No surgery, anesthesia machines collect dust. When a hospital closes completely, the Biomed goes too. And with them goes technical knowledge, maintenance, continuity, and safety overnight. In many of these regions, access to care is already razor thin. Only 12% of doctors practice in rural areas, though 20% of Americans live there. In some counties, there are no practicing physicians at all. That shortage is projected to worsen, by the way, with rural areas losing 23% of their physician workforce by 2030. Medicaid also supports maternal care in these areas, funding 47% of all rural births. Cuts to Medicaid jeopardize more than hospitals. They threaten lives from day one. Texas may be the most viable case, but is far from alone. States like Alabama, Georgia, Mississippi, Missouri, Oklahoma all have dozens of rural hospitals on the brink. What do they have in common? High rural populations, low Medicaid reimbursement rates, and in many cases, no Medicaid expansion under the ACA. Combine that, and you get underfunded hospitals, overworked staff, and a system that can't even sustain itself. 1 in 4 rural hospitals nationwide is operating at a loss, and Medicaid-heavy counties, closer to 1 in 3. If you're a biomed in rural hospital, start thinking about this. Document your value. Track your PMs, your emergency calls, your uptime. Make your work visible. Understand how reimbursement affects your department, even if you're not the one signing the checks. And speak up. If your hospital is losing services, advocate for how your role evolves, what you need to do to keep things safe. To everyone listening, these aren't just budget cuts. These are care cuts. Cuts to access, to safety, to the quiet systems we already rely on. When those systems collapse, the people most effective won't be in the boardrooms. They'll be in the hospital beds that no longer exist. These conversations aren't always easy, but they matter because people matter. Because the care we provide, the quiet work that we do behind the scenes, it's worth protecting. If this episode is to give you anything, something to think about, please share it. If it helps you see things differently, subscribe so that we can keep the conversation going. And if you believe in maintaining our rural healthcare facilities, then speak up. You know, it's rural hospitals hold a dear place in my heart because a lot of my career has been honestly taking care of them. I know a lot of the constraints that they face. And unfortunately, during my years of being a biomed, I've seen so many rural hospitals that I personally took care of just close doors. And I don't foresee that changing anytime soon. So if you are a biomed and you're currently taking care of these, institutions that will drastically affect communities, you need to let them know exactly what your constraints are, and also make sure you have a voice at the table to keep these healthcare facilities open in our rural communities. I hope somebody got something out of this. Like I said, this is a subject that I felt was important. If you think so as well, I would love to hear your comments, concerns, experiences, stories. Like I said, let's keep the conversation going. Anywho, thank you for watching. Please like, subscribe, and share.
Bearded
And may the beard be with you. Take care.
Biomed.